All right, let's get more on this now from Dr. Kerem Kinik. He is the president of the Turkish Red Crescent and joins me now live from Istanbul. Doctor, thank you for joining us on the program. What is the situation right now in Turkey with collecting plasma to use in this treatment? Where is it being done, and is enough being able to be collected?
On March 15, we as Turkish Red Crescent, Türk Kızılay, asked by the Minister of Health of Turkey to help identify prospective donors and manage the distribution of these products to hospitals treating patients in need. Currently, we are collaborating with Minister of Health to develop process to identify and qualify individuals who have recovered from the virus and have antibodies that may help patients seriously ill with COVID-19. Nowadays, we are extending the collecting provinces. Almost every metropolitan municipality provinces, we have plasma pharesis facilities, even belonging to the Turkish Red Crescent or the teaching hospitals as well. Now, slowly rising up the trend, upward trend, because we are collecting from the first the patient group. But next week, we hope we will cover all requirements.
So where is this therapy being used right now? What are the plans to distribute the plasma? Is this something that will be rolled out to all hospitals in Turkey at some point?
Sure. We have a triage, bioethical triage rules. According to that triage rules, the hospitals requesting, also demanding that plasma from the Turkish Red Crescent blood banks. And they have a right to collect some recovered plasma from their own also recovered patients. But there is a queue waiting list. And starting from the serious cases, now we are distributing daily 20, 30 plasma to 50, 60 cases.
Mm-hmm. And this type of therapy is only being used on the most critical patients. I know that we are seeing an increase in the number of deaths here in Turkey. How do you hope that this will help in stemming that?
Actually, our also number of weapon is very limited, and the demand is huge because of nowadays we are using this the convalescent plasma therapy for the seriously ill sick people. But after rising number of the convalescent plasma donors and our pool, we will start to treat the moderate people as well, suffering because of the COVID-19. And we have a plan to get ready for the second wave of the pandemics. So we have a plan to store this convalescent plasma in our warehouses as well.
Talk to us about how this plasma is gathered from a donor. How many patients can one donor help? And is it a difficult process for someone who donates?
No, it is a very simple process, such as blood donation. It takes 45 minutes. If you compare with the blood, it's 15 minutes. But the plasma pharesis running like this, just we are collecting the liquid part of the blood, we call plasma, not the red cells and others. So very simple process, and there is no harm against any kind of also donors. So we are collecting, testing. We have some requirements from the donors. Must be 18 to 60 age and between, and the donors has no communicable diseases like hepatitis or HIVs, and must be below 50 kg. And we are testing and frozen that the plasma and distributing, delivering to the hospitals. And it is very easy process. And each donors in one session, they are also donating 400 milliliters, and we are dividing two, and each session can also help 2 patients.
All right, we'll leave it there. Thank you for some great information, Dr. Kerem Kinik. Thank you so much for your time.